As I said before, now I'm back again just to introduce the whole project and what the project is all about. And then, after this intervention and research, neglect of also disciplines, particularly social sciences, are not really utilized when it comes to skin diseases and other health problems. I would say, I think health is usually considered as a biomedical issue, and it's usually considered as jurisdiction or domain of medicine, domain of public health and social sciences. A number of disciplines have not received adequate attention, and also neglect of communities and patients in 3 countries: Ethiopia, Sudan, and Qatar. So it starts from this assumption that there is this neglect, and we should address it. We should do something about this and try to end the neglect. So just to unpack maybe to further, so the neglect of the 3 heavily stigmatized skin conditions, porokeratosis, mycetoma, and scabies, neglect of affected patients and communities at different levels in 3 countries, neglect of the social sciences as vital global health disciplines rooted in other countries. So we try to address each of these local, national, and global priority. Representation of the health problem as biological and the solution as technological is flawed. I think nowadays there is so much improvement, which is I think something good. But particularly in the past, we always consider that health is something biological, illness is something biological, genetic, or it's caused only by germ or bacteria or virus, and we don't usually pay attention to a number of other contextual and social issues. Health is in effect a biosocial issue and requires both biological or medical as well as social intervention and social approach. And so we need to understand the cultural, political, economic, historical context in which health, illness, and healthcare is operating in any society. And therefore, stigmatized diseases need both medical and non-medical interventions, and that's what this research is all about for non-medical interventions. We need to pay attention to non-medical interventions and utilize social science disciplines as much as possible in researching skin diseases, stigma related to skin diseases, and other issues related to NTDs. How can social sciences contribute? They contextualize the problem. That is one of the main contribution of social science. That they try to understand the causes of the causes. We may say that scabies is people get maybe porokeratosis because of genetic susceptibility, because of the exposure to soil. But then it's not that all people get it. There are a number of contextual factors why people really get porokeratosis. So social sciences really try to understand those contextual issues, those social issues, or the cause of the causes, and social determinants, what we call them social determinants. So it also gives the people's perspectives. Social sciences usually contribute to get the people's perspectives, that is, to understand any perspective, to hear from the horse's mouth. Usually social sciences utilize qualitative research, and qualitative research usually tries to get the people's perspective. It's not maybe the researcher's perspective, but also the researching of those people who we are engaging them. And we engage that. Social science research usually engages those people who we collect data and law as compared to quantitative public health or medical research. It pays also attention to complexity. Social sciences pay attention to the complexity. There are a number of programs with a very strong evidence base, or with a very and straightforward to implement. For instance, that maybe to eradicate, to eliminate or control scabies, we need to administer mass drug administration. Or we may say that people need to put on shoes in order to control and eliminate porokeratosis. But it's not as simple as that. There are a number of complex issues to change that, to change behavior, or to really to achieve the desired effect. And social sciences usually take that or factor in that complexity and try to design interventions factoring a number of complex interplaying factors. And social sciences also help develop culturally informed interventions, cost-effective interventions, feasible interventions, that can be really, that take into account the culture, the habit, the tradition, and whatever social, economic, and political context of the community in which the intervention is based. So our general aim is to transform the lives of people who are affected by two conditions, particularly in Ethiopia by scabies and protoconosis, by identifying interventions informed by social science perspectives at the level of the patient, at the level of the community, and at the level of at the national level, or at the national level. That is our general objective. But we have also specific aims that we want to address in the next 3 years. Now it's only almost 1 year and more, but we have 3 more years to go, and hope that we will get also no cost extension because of coronavirus, which delayed us, which a little bit delayed our activity. So we have these aims to examine the cultural logics and social and economic context of the selected entities, utilizing cross-cutting social science perspectives. To understand the dynamics and dimensions of stigma, how are people experiencing stigma, how are they coping, who are stigmatized, what is the role of different social factors, class, religion, socioeconomic status, in terms of coping or in terms of being stigmatized. We try to understand self-stigma. Do policies exist in the first place, for instance, concerning scabies? Do policies and guidelines and strategies exist concerning tuberculosis? And then how are they conceptualized, how are they articulated, and who played the role, and who are the actors, and all that. We would like to understand that. And we would like also to evaluate existing intervention in areas in which they have already been developed. There are a lot of interventions, particularly on tuberculosis. As you have introduced before, we have several PhDs, postdoctoral fellow, and that really creates enduring capacity in developing countries to help to research not only maybe these diseases, not only maybe entities, but also other health issues. And we also, this project also aims to facilitate South-South and North-South sharing of best practices. We have students from, I think we have trainees here, which I introduced before, and there are also academics like myself and others who are also involved with the supervision of them from the South.